Health Minister Kweku Agyeman-Manu has told Parliament approval has been given by Finance Minister Ken Ofori-Atta to pay 4 million cedis to the Korle Bu Teaching Hospital to clear debt owed its suppliers of consumables. The outpatients department of the renal unit was closed for months, with 19 renal patients dying during the period. The hospital refused to comply with the order to open the unit for almost a week due to a debt crisis. According to Kweku Agyeman-Manu, the debt is set to be settled to allow the hospital to operate without a challenge. Kweku Agyeman-Manu also informed MPs government is backing Korle Bu Teaching Hospital to renegotiate its contract with a South African firm which has a monopoly over the supplies.
Korle Bu has accrued a total debt of a little over 4 million Ghana cedis to its partner. Furthermore, it remains a fact that the current charge of 380 cedis for dialysis is insufficient to enable the RDU to generate enough revenue to fulfill its full obligations under the contract with FMC, especially as it does not have a hedged exchange rate per annum regime. This has compromised the ability of the RDU to raise the funds required to pay for consumables procured from FMC promptly. Mr. Speaker, again, due to the high incidence of patients requiring dialysis, the total cost of care keeps rising, adding to the accumulation of debt. Mr. Speaker, it must be noted that currently patients on dialysis are not on the National Health Insurance Scheme. Mr. Speaker, the Korle Bu Teaching Hospital, in consultation with the Minister of Health, has initiated discussions with FMC for review of the current contract for more flexible payment options and a more structured supply of consumables to avoid excessive delays and to ensure delivery of the outstanding 45 dialysis machines and auxiliary equipment to boost the service being rendered. Mr. Speaker, in the meantime, the RDU has been opened to the public since Monday, 6 November 2023, to add patients as directed by the ministry. The MOH has since made a request to the Ministry of Finance to settle the total indebtedness of the 4 million Ghana cedis. And the good news now is that the Minister for Finance has just approved the disbursement of this 4 million to support our patients in Korle Bu.
On the minority side, the Honourable Muntika Mubarak has been reacting to the issue about dialysis crisis in the country.
Problem at Korle Bu Teaching Hospital, I see it as leadership failure. I see it as government not being responsible for the health of the people of this country. Mr. Speaker, all I'm saying is that there's no priority for the health of the people of this country. Mr. Speaker, go through the statement. Apart from what the minister is proposing now in terms of policy, we haven't seen government intervention in this instance, apart from what FMC that has donated dialysis machines to Korle Bu, and the First Sky Group that has taken it up to offer free services for renal patients. Before now, I don't see, or the minister has not demonstrated or shown us what government has done so far until now. We cannot have a situation where the whole government comes in only when there's crisis.
If you take, for example, the fees and charges that we gave, 380, yes, over the period, there may be some challenges, what we call exchange rate difficulties, but Confanoche is operating with the same 380, and they've not closed the unit. Yes, I will agree. Kofanoti has, I think, about 10 machines, but largely you go and you have between 2 to 8 that are working at a time. But Kofanoti is operating with that. If you go to Brekum, where you have the Catholic hospital, even though this house gave a fees and charges of 380, the Speaker, they are charging 350. They are charging 350 and they are able to operate. Now, when you go to the private facilities in Kumasi, we have about 4. The one that I remember very well is what we call KNUSC Teaching Hospital, and then is it God is Love, another private facility. Mr. Speaker, they are charging 500. Remember those who are charging 500, who are private facility, they pay their nurses, they pay their specialists, they buy their consumables, they do all that, and they charge 500 as private facility. Now you come to Korle Bu, where it is the state that is paying for the specialists, the state that is having the the infrastructure and all the nurses and all of that. They are making us believe that the only way Korle Bu unit can operate is to charge up to about 900. Mr. Speaker, I'm happy the minister himself acknowledged that contract with FMC needs to, they are looking at it. That is where the problem of Korle Bu starts.
And there's been calls for NHIS to absorb the treatment cost for kidney issues, but the financial issues of the scheme have come up as NPP MP and also former health minister has been speaking against government's capping of the NHIS funds.
The kidney failure, the liver failures, even some diseases, every country controls its own destiny, so to speak. So let's have a national conversation, look at the funding of health insurance, and the finance minister has no business capping what we call it, the NHIS, because it's unconscionable. And then finally, those who are making informal payments in the system, they should be brought to the table to be re-examined and then formalize them. And then finally is that we should look at another way of even adding additional income. Because everybody is saying that let's fund this. They are looking at the benefit side, but they are not looking at the revenue side. So if we do that, we will not be running a health insurance system.